Hi everyone. So my topic today is about eating disorders, and I chose this topic because I have a really close friend who's very dear to me, and they suffer from an eating disorder. So their symptoms often fluctuate from anorexia to bulimia, and one day they might be having like an intense fear of gaining weight and they restrict their eating, and then another day they'll be eating a lot but end up throwing up or exercising excessively. And so I can only help so much, and there are often times when I feel helpless and I don't know what to do. And so the problem is that a lot of people struggle with eating disorders, whether they or we even realize it. And the causes can be some genes associated with specific personality types, according to the Center for Eating Disorders. Common personality traits include obsessive thinking, perfectionism, and impulsivity. Another thing is that social influences such as weight stigma, of being thinner is better, teasing and bullying, and socially defined ideal body, according to the National Eating Disorders, can also be another cause. But there are health consequences when it comes to these eating disorders that can be really dangerous and fatal to our health, according to the Eating Disorder Foundation. So for instance, for anorexia, you can have heart failure and have pregnancy complications, and for bulimia, you can get an inflammation and rupture of your esophagus, and this can also lead to cancer of your esophagus also. And learning about this information today is relevant to the class because I'm pretty sure we've all felt insecure, unhappy, or judgmental about our appearance and our body image, and this can lead to eating disorders, whether we realize it or not. And also, we may know friends, family, or significant others who are struggling with eating disorders also. And for society, social media has such a big influence nowadays, and it's created this idea that being thin is beautiful. And it causes body dissatisfaction, which can lead to eating disorders, and can be really fatal and dangerous to our health. And so my purpose today is to persuade you to educate yourselves on the importance of eating disorders. So my solutions are to learn more about the different disorders and what their symptoms may be, to talk to your children, family members, friends, or significant other about eating disorders, and lastly is to just take the first step towards recovery together by showing your concern and seeking professional help. My focus today is the article about eating disorders from the Eating Disorder Foundation, the National Eating Disorders Association, the article Eating Disorders by the Mayo Foundation for Medical Education and Research, and the article What Causes an Eating Disorder from the Center for Eating Disorders. And so there's actually a national survey that estimates that 20 million women and 10 million men in America will have an eating disorder at some point in their lives, which shows that the problem is that a lot of people are actually really struggling through eating disorders. So the first solution is to learn more about the different disorders and what their symptoms may be. You can do this by reading books, articles, and brochures about eating disorders, and know that there are others aside from anorexia and bulimia. So for instance, there's also binge eating disorder, where it's similar to bulimia, except there's no purging or unhealthy methods involved to cutting your eating. And that person can also feel a loss of control, as well as having distress or guilt after they eat. Other symptoms may include extreme concern with your body size or shape, skipping meals or taking smaller portions than regular portions, frequent dieting, and sometimes they'll have cuts and calluses on top of their fingers from induced vomiting. Another thing you can do is you can acknowledge the differences between the facts and the myths about weight, nutrition, and exercise. The second solution is to talk to either your children, your family members, friends, or significant others about eating disorders, whether you're personally going through it, know someone who does, or the person you're talking to is actually struggling through it also. Before you talk to them, try to rehearse what you want to say to reduce anxiety and to clarify your main points. Also, make sure you set up a private time to talk to them about it for privacy and confidentiality reasons. And when you're talking to them, be honest and talk about your concerns. And make sure you use I statements such as "I've noticed" to avoid sounding like you're accusing them of having that disorder. And the third solution is to take the first step towards recovery, either by showing your concern or seeking professional help together. So when you're showing your concern, be caring but be firm, and avoid making promises, expectations, or rules that you can't uphold, such as like, "I promise not to tell anyone," or "If you do this one more time, I won't speak to you again." Also, remove the potential stigma and remind them that there's no shame in admitting that they're struggling, and that it's always okay to ask for help. And lastly, encourage them to seek professional help. By doing this, you can offer help on a physician or therapist or go to a session about eating disorders together, because many eating disorders actually require professional help to actually get better from it. In conclusion, the problem is that a lot of people struggle with eating disorders, whether they realize it or we don't realize it. So the first step is to learn more about the different disorders and what their symptoms may be. The second solution is to talk to your children, your family members, your friends, or significant others about eating disorders. And lastly, just take the first steps towards recovery together by showing your concern or seeking professional help also. And with that, I would like to end with a quote by Margaret Thatcher in which she said, "You may have to fight a battle more than once to win."